Good afternoon. Today we're here with special guest Nicole Leuthe. She is one of our clinical therapists here at Alpha-Medicor, and she is just coming up on 4 years of working with our organization. We're doing a little bio on Nicole. Nicole, can you share with us a little bit about your educational background and why you chose addiction medicine?
I have a Bachelor of Science from Keystone College, and then I went on to get a Master of Science from Shippensburg University. And I always wanted to be just in the helping field. And I chose addiction medicine because I really feel that it's misunderstood. People don't understand the disease of addiction. They think it's a choice. They think, people choose this way of life. And I am really passionate about that it's a disease and that people, don't want to live this way and that they need help.
Fantastic. What can you share that is one of the hardest things to help a patient with that you do day in, day out? What are your challenges in your job treating patients?
I think the first thing is when a new patient comes in to see us, they're so scared. They're so full of shame and guilt about their situation of their life at this time. So just getting them to understand that we're here to help them and that they're able to change their life. They don't have to feel this way, that we understand. And then there are people out there that understand. And then once we begin treatment and work on, different issues, building their career, their personal life, sometimes just getting them motivated about, goals and future and what they really want.
Fantastic. Good answer. Why should a patient come to Alpha-Medicor versus, say, the other doctor down the street? What services do you see as an employee that you provide that others don't?
Like I said before, I think that we really understand how a patient feels when they first come in the door, or even before that, when they're thinking about treatment, before they even make that first phone call, that they're so scared. We really, really understand that. And we just provide compassion and support and understanding and just help them get their life back to where they need to be.
Okay. What does it look like out there with addiction as a whole? You've worked here for 4 years. Is it getting better or is it getting worse out there?
Actually, I think that's a good question, but I think it is getting better. I think that people are beginning to understand more that it is a disease, that it's not a choice. So in that respect, I do think it's improving a little bit. But we hear every day about people, overdosing, and it's serious, and that there's a lot of dangerous drugs out on the street. So in that respect, it is scary and dangerous. But people are understanding more, so it's kind of a mix.
Okay. Last question.
Mm-hmm.
There's a patient out there looking at you and, believe it or not, listening to this video and wants treatment. What can they expect from you as a clinician here at Alpha-Medicor if they do pick up that phone call and ask for Nicole?
You would be greeted from everybody here with compassion and understanding and warmth. And then just to sit down with me, and I just want to hear your story, and I really just want to understand and meet you where you're at and what you want to work on, and just understand you and your goals. And we'll just work together to get you where you want to be.
Okay. This is my second to last question now because it just came into my brain. Share with me, with medication-assisted therapy, i.e. Suboxone or Vivitrol or any of the other types of medications out there, it gets a bad rap. Why does Suboxone specifically and or Vivitrol get a bad rap in the community? Why should, I'm hesitant, I don't want to go on it, but I do need it. What would you say to a patient that's suffering, say, from opioid dependence and wants to go on Suboxone but is scared to be judged?
It lets you stay at home with your family. It lets you continue working. It lets you, if you want to, go to school and improve your life. It allows you to do this. It allows you to work on goals and be seen by a clinician. Come in here, be seen monthly for medication, and also work bi-weekly or weekly with your therapist here. So it allows you to live your life.
Is it ethical, though, to take medication to help me, in your opinion?
It's absolutely ethical. A lot of people will say it's, oh, you're just replacing, one drug for another. It's the same thing. And it's absolutely not. This medication, helps you get your life back. As we said, it helps you. You don't have the cravings. You don't have the pain of withdrawal or that obsession with, how am I going to be okay tomorrow, really. It allows you to live your life. So it's absolutely not replacing one drug for another, because this is treating you, to get better to where you need to be.
Fantastic. Nicole, thank you. You survived your first taping, and we look forward to hearing more from you in the
Thank
future.
you.